It is my pleasure to be here to present my research work of the last 56 years. What we're going to demonstrate is that when you give a good adjustment, you get tremendous results, and only research that is being published will prove that fact. Now, I dedicate this work to Dr. Ralph Gregory, my main mentor. He developed all the work that I am standing on and have improved over the years. Dr. Gregory died in 1990, and we're trying to carry on his legacy. The NUCCA orthogonal radiographs. If there is a 3/4 degree of misalignment and is reduced to a 1/2 degree, that is only 7/1000ths of an inch. Basically, if you figure out mathematically, it comes down to 6.7 thousandths of an inch. We're not dealing with pinched nerves, as everybody thinks we are. We're dealing with sensors, and this is what we're trying to show you. In our work, we take 3 different x-rays, one lateral, one nasal, one vertex, and I'll show you the reason for it. The fact is that you have to know the angle of the atlas on a lateral film so that what we call the plane line, you can see the attachments of the posterior arch of atlas as they cross the lateral mass. On the nasal film, when you draw the central skull line, which is above the squamosal sutures, that will be the center of the skull. And then we have a line going through the atlas, below the posterior arch across the lateral mass, and with that accurate line, we would like to have that at 90 degrees. That means there's no side slip of the atlas. The lower cervical should be 90 degrees to the line going through the atlas, or we call it the plane line. That is a perfect alignment of the head and neck in a nasal view. On the vertex film, this would be a change for some of the people that didn't understand that the foramen magnum is not in the center of the head more than half the time. Dr. Sherman came out with a paper many years ago and said the foramen magnum is not in the center of the head more than half the time. So the NUCCA organization has okayed the new measurement, and that is you have the chin on center, the glabella on center, and the posterior of the inferior portion of the occiput is where the head clamp goes, and that will center the head to the line going through the center of the grid. And when you center the head to the line going through the center of the grid, and you measure the rotation of the atlas to that line, you are checking the rotation of the atlas in relationship to the whole head. This eliminates the idea that the foramen magnum is in the center of the head. So we're measuring atlas rotation in relationship to the whole head. This has worked out and proved in itself in research projects. What is a perfect correction? And that's what we're always striving to do, is give people a perfect correction. And it can hold for years until they hit their head or a mental or physical shock. If the atlas is off 1/2 degree or 0 degrees of laterality to the central skull line, that's atlas laterality. In 10 to 15% of the cases, there is not total symmetry in this area. In other words, I refer to it as a short condyle. But if the bottom of the skull is not level, the axis body is high on that side. You'll never get a level plane line. And any laterality is left in the upper area, it should be matched to the lower cervicals being off to the opposite side at the same. That's very important. The plane line will never be level, and the opposite, the cervical angle will be opposite at any laterality that is left after you reduce atlas laterality. Now, this is after 56 years of research, I've come to this conclusion. The mechanism, or the thing that we're working with, is not pinched nerves. It's called proprioceptors. Between the lateral masses of atlas and the occipital condyles are the crux of spinal distortion and other diseases. In other words, the facilitators and inhibitors of all the muscles of the spine lie in the central reticular formation. Now, therefore, if your hips are not level, you have stress at the base of your brain. Then proprioceptors are out of balance. It's not mechanical receptors. The mechanical receptors are more from the outside. Proprioceptors are from the inside. So the conclusion is that if those proprioceptors are not perfectly balanced, in some cases as much as 7/1000 of an inch, you still have stress at the base of your brain. And we'll cover more points of that. But the point is that no matter how well a patient checks out, until we see the final post x-rays, we'll call it, until those show a perfect alignment, we have not done everything for the patient. One of the ways we measure spinal distortion is what's called the anatometer. The anatometer checks the weight on each foot. The difference between each foot should be within 4% of the total body weight, and that'll come up with that. But that's not the most significant thing. The most significant thing is the pelvis has got to be level within a half a degree. And the shoulders the shoulders can be affected also, which we'll cover. And there should be no twist. The pelvis should be above the 2 feet. We have a little leeway there, but not very much. And now we have a posture manuscript coming up shortly. It will correlate all distortion of the spine, come back to balance with a good adjustment. When we adjust the patient and we give them a good adjustment, it holds, and they only require 1 or 2 adjustments over many months. Barring mental and physical shock. Remember, one of the things they can't do is have their hair washed backwards at a beauty salon. No neck hugs, and the head is never be hyperextended. Those are little things that may knock out the adjustment. Riding a 10-speed bicycle where they leaning forward and throwing their head back, that's not good either. Can't sleep on their stomach, can't sleep with the shoulders twisted. This all aggravate the nerves. So if ever they get up during the night or first thing in the morning, they're more in pain than went to bed with, they slept wrong. They got to educate the patients on how to sleep also. The neck is that critical. My wife's idea of using laser lights to measure spinal distortion is fantastic. We put laser lights on the hips and on the shoulders, and the chart is 6.5 feet away, and you can see any tilt of the shoulders or the hips. The hips have got to be level, the shoulders maybe 1 or 2 degrees off, and there can't be any twists. Over here we have a dot that's on 0 on the lower line there. The laser lights on the shoulders are a little bit narrower, so the 0 there is off to one side. And that patient can actually see if there's any distortion in the spine by looking at the hip level and the shoulder level. I might say this, if there is a 1/4-inch twist from the shoulder girdle to the pelvic girdle, they still have stress at the base of your brain. The brain loves symmetry. The base of the brain controls the facilitator, inhibitor of all muscles in the body, and if those are affected, you'll still have twists in the spine besides the fact that the hips won't be level. Well, that's the basis of support for the spine. And here we have one of my first studies. We're trying to check the heart rate with people that have diabetes. That where Dr. George Bacris, who helped us on high blood pressure, knew Sarah Webster, who was in charge of research projects at Life College in Marietta, Georgia. And she got them to give me $2,000 to help in investigating plasma glucose levels and heart variability. And we found some change in glucose. The hypertension study. This was the first time in history that anybody proved that we did have something that will affect the autonomic nervous system, and not just musculoskeletal conditions. It was a medical research project of 50 patients, half for a placebo group. And the ones we adjusted, only 21 patients only received 1 correction in 2 months' time. Blood pressure went down 17 points, and the diastolic went down. And it's equivalent to 2 medications. And we took blood pressure very scientifically. No coffee in the morning, an empty bladder, and then they came in the office, they drove for 45 minutes. The arm as high as the heart. They put the cuff on for 5 minutes. Then they took the blood pressure. Wait 2 minutes, take the blood pressure, wait 2 minutes, take the blood pressure, and then average it out. So they eliminated as many variables as possible. Over here you can see the placebo group, there was no change in atlas laterality, no change in rotation of the placebo group. An adjusted group, we went from the atlas laterality 2.17, came down to 0.22. The atlas rotation was 1.29, came down to 0.19. And 8 weeks later, this is very important. 8 weeks later, we re-x-rayed all the patients, the placebo group and the group we adjusted. And we found the atlas was locked either in the non-subluxated state or in the subluxated state. In other words, the atlas is locked in the frontal plane and the transverse plane, not in the sagittal plane. We're going back to the pelvis. And using the anatometer, over here we have the placebo group and the people we adjusted. And the placebo group did not change in pelvic distortion. And then after we adjusted them, the pelvic distortion came down next to nothing. And the rotation of the pelvis going off to one side, what we call it transverse side. The placebo group did not change, and the rotation went down to a 2 to maybe a half. We do have a little tolerance there, not much. And then what's called the spinal lateral spine distortion. We're talking about the 7th cervical, 1st dorsal relationship to their feet. You can see that was off to about 1, it came down to about 0. Subject discernment, meaning a patient that we adjusted, did they know they're in the adjusted group or they didn't know? The head of NIH, long time ago, said, how could chiropractors do a placebo group? Well, this is the proof. Because when we adjust our patients, we only dent the skin a 1/16th of an inch or an 1/8 of an inch at the most. But there has to be some force behind it. If you do this correctly, a reflex takes place and the vertebra move ahead of the reflex. Of the 25 patients that were adjusted, 12 thought they were adjusted, 13 thought they were in the placebo group. Of the placebo group, 6 thought they were adjusted, 10 thought they were in the placebo group, and 8 had no ideas. That shows you that I did not go in deep to adjust these patients. Scoliosis case. No matter how much you do to try to help scoliosis cases, it's caused from the base of the brain, the facilitator inhibitor. And here's one case. She had a 44-degree scoliosis, came down to 32 degrees in just a matter of 5 months. One adjustment, and that was printed. One adjustment, a 15-year-old girl went from 44 degrees to 32 degrees, one adjustment. When the pelvis levels off, every vertebra in the spine moves, and that reduces scoliosis. Now here we have a 19-year-old boy with ADD. Now we're talking about a special instrument the Lexington Brothers has here. It's called magnetoencephalography. It picks up a magnetic field in the brain. Here we have a 19-year-old with ADD his whole life. He received only 2 adjustments over a 2-month study period. In fact, he held his last adjustment for another year. But his health improved with only 2 adjustments over a 2-month period. Had 100% recovery on ADD. This is the instrument that they use, magnetoencephalography. Picks up a magnetic field around the brain, electrical activity, determines functions in various parts of the brain. Dr. Levine runs it at the hospital and shows you how intricate it is. And Lexington Brothers Hospital is a big hospital outside of Chicago here. On the study report with Dr. Levine, he shows how the scans have improved. Improvement in the first graph there, and we call post-adjustment within normal limits. In other words, we changed the magnetic field in the brain. But one adjustment. We also had a 20-year-old bipolar. She also had an improvement in 2 months' time with the brain scans. Female bipolar. This is a RAND 36 study with a 19-year-old ADD case. The blue line at the very top is the average in the United States, and every 3 months we gave another examination. And these are functional functioning, role physical, bodily pain, general health, vitality, social functioning, role emotional, mental health, and how he improved every 30 days. In fact, there's a line at the very, very top, he had 100% improvement, healthier than anybody else in the whole world. We also use a sleep index study, the lower number the better, and you can see how the graphs went down over 2 months. The sleep study quality, sleep latency, sleep duration, sleep efficiency, sleep disturbance, sleep medication, daytime dysfunction, and the lower the number the better. And here it went down over 2 months. Autism study. It's very difficult to take care of autistic children because the x-rays we take have to be so accurately taken. If they don't hold still, you can't x-ray, you can't adjust them. Never adjust anybody without x-rays. Of all probability, you'll increase their subluxation. So the subscales on autism, the way they do it is speech, language, communication, social ability, sensory, cognitive awareness, health, physical, or behavior. 7 out of 11 subjects received only 1 correction over 4 months of care, only 1 correction. Remember, the lower the score, the better. And there's the speech, sociability, sensory, health, physical, and overall. Shows how the scores went down. Very proud of that. Headache pain study. Out of 47 patients, age 18 to 65 years of age, 4 months study duration. Average age of suffering was 9.4 years of suffering. 35 patients only received 1 adjustment. There's a pain scale, VAS scale. It was almost 6, and in 8 weeks' time, it came down to about 1, a little over 1. Look at the p-value there, 0.001. On chronic fatigue, another big research project. 20 subjects, actually 1 dropped down right off the beginning. She had a metal plate in her neck, and her husband was diagnosed with cancer. But she dropped out right away. But all right, we used the RAND 36 study. It was published. The Good Shepherd Hospital, the SPED scans, radioactive isotope around your brain showed no improvement. Sleep index showed an improvement. The chemistry showed an improvement, and we're happy to show you what we've done. 10 out of 19 patients don't receive one adjustment in 6 months. I'm trying to show you the validity of what a perfect adjustment can do. Overall improvement, the EEG, blood chemistry revealed normalizing of PM cortisol and ACTH. These patients received 5,000 tests at the Good Shepherd Hospital, and the SPET scan showed nothing. That's the radioactive around the brain. And the cortisol levels came down to normal, which we're happy with. But the patients, remember, 10 out of 19 patients only got one adjustment, and their health improved in 8 categories using the RAND 36 study. You can see on this chart, the real dark line at the top is normal health in the United States. But look at the results these patients got after 3 months and 6 months. They're coming up towards normal health. Remember, all over the world, they cannot find any correlation. We give them a good Atlas adjustment, and we got tremendous correlation with them having a strong and balanced spine and better health, overall health, in 8 categories. Pittsburgh Sleep Quality Index, they all showed an improvement. The lower the number, the better. The real dark red one is when they came in. The yellow, they showed improvement in their overall sleep index study and all these different categories. Blood chemistry. This shows the improvement of the AM and PM cortisol level and ACTH. This is big. Of all the pills in the world given for pain, the United States uses 80% of the pain pills, and people are dying from it, from being overprescribed with pain pills. It's disastrous. So we had 239 patients in a row. We watched their VAS scale on the first 2 major symptoms. The majority of these patients were complaining of cervical pains, lumbar pains, and headaches. Over 3 months, 75% of patients only received one adjustment. The paper is being put together and being published. We're very proud of it. On the pain scale, look at the VAS scale. On the primary symptom, 0 to 10, the majority of them are following about 5 or 6. And after adjustment, look how the pain went down to nothing in most of the cases. Most of the cases, pain went down. Look at the p-value, 0.001. Atlas laterality of these cases was off at the average of 1.97 degrees, and after adjustment came down to 0.31. That's what a good adjustment can do, reduce atlas laterality. And the pelvic tilt, remember, any stress that makes your brain, you twist your pelvis. And if there's stress that makes your brain, your pelvis will be higher on one side than the other by at least more than a half a degree. So the pelvis will tilt to 3.15 degrees, and after adjustment came down to 0.18. I hope you can find this information useful in your practice.